Thank you so much, Diane. Besides serendipity, opportunity, receptivity, and mentorship, I meant to also say perseverance, and there is an example. Foundation for Women and Girls with Blood Disorders is focused on really all benign blood disorders for the most part, and improving the outcomes for women and girls with them. Diane, you talked about platelet disorders, and her case illustrates the problems women have with heavy menstrual bleeding if they have a platelet count of 1. So, she mentioned sickle cell disease and pregnancy. We have a network. FWGBD has a network of providers who are focused on bleeding disorders. We also have a network that is getting established around sickle cell disease and pregnancy. Keep that in mind. The next career pathway we're going to hear about is Dr. Michel Recht. Dr. Michel Recht is professor of pediatrics at Oregon, it's an O, Oregon Health Sciences University. And he has been a mentor. He has inspired people into careers in women and girls with blood disorders. He's on the board of directors. Welcome. Thank you.
Thank you, Andy. My lesson from that first talk is never to follow Diane Nugent in giving a talk. I'll try to be quite as inspirational. So I grew up in Milwaukee, Wisconsin, and did all my schooling at University of Wisconsin. When I graduated high school, the University of Wisconsin started a program called the Medical Scholars Program. And this was a program where people could get admitted to medical school right out of high school. You could do 2, 3, or 4 years of undergrad, didn't have to apply, didn't have to take MCATs, just got admitted. There were a couple things you had to do to stay in the program. You had to keep a 3.0 grade point average and nothing lower than a B in the pre-med classes. So one of the themes I want to talk about is your career doesn't have to be straight. It can always be, there can be twists and turns, because even though I was in that first medical scholars program class, I was also the first person kicked out of the medical school scholars program when I got my C in organic chemistry. I was called into the program director's office. I was told, some people just aren't smart enough to be doctors. Maybe you should consider a career in some other field. So if you ever want to get a kick in the butt to really start working hard, be told you're not smart enough. I eventually got into the University of Wisconsin Medical School. I found out 2 days before school started. I got accepted in off the waiting list, and because I had this opportunity as a medical scholar before I got kicked out to really explore things that were interesting to me, I graduated with my undergrad in philosophy and psychology, went into medical school, which in those days meant memorization and 50 question multiple choice tests, and I hated medical school. So after the first 2 years of medical school, I went to the dean's office and sat down with the dean and said, I think this really isn't for me. I need something a little bit more creative. I think I'm going to go to grad school instead. And he supported me in that decision, but said, instead of quitting medical school, why don't you just take a leave? And then, when you're done with grad school, you come back and talk to me again. So while I was in graduate school, I worked in the lab of a physician at University of Wisconsin who was in pediatric hematology oncology. His name is Dr. Paul Sundell, one of the most remarkable human beings you will ever meet. I don't know if anybody here knows Dr. Sundell. I thought I was going to be the guy who was going to cure pediatric cancer, but when I was sitting in on some of the clinical meetings, that's when I met Dr. Nugent. And she doesn't remember this, but it's like there was a little light bulb in the back of my head. Like, hematology is pretty cool. And although cancer biology is neat and taking care of bald kids is great, hematology just seems a little bit more interesting and there's more unknowns. So taking my lead from Dr. Nugent, when I started my residency, I hooked up with another mentor in New Haven whose name is Diana Beardsley, unfortunately the late and great Diana Beardsley. And Dr. Beardsley really got me interested in this idea of non-malignant hematology as a career, incredibly brilliant and thoughtful, and just taught me not only how to think critically about my patients, but also how these interesting things about patients can turn into research questions. This was also at the tail end of the HIV era in hemophilia. So in 1992, when I started with Dr. Beardsley in New Haven, which is a pretty small town, I think it was probably about 250,000 or 300,000 people at that point, we lost 50 kids in that 1 year to HIV. And that has stuck with me forever. And taking that experience and remembering that these therapies that change the life of children with bleeding disorders also cut short the life of people with bleeding disorders, making sure that people have safe and effective therapies has sort of been the motivation behind my career. So I did work in a lab during both my residency and fellowship following up my PhD work, and got my K award and had 15-20% clinical time, 80-85% protected time. And what I found for me was that wasn't adequate. I was not able to stay competitive in the hardcore world of bench research with that 15-20% clinical time that I have. And that's only for me. There are other people who do that very well. But because I was having struggles with that, I started to look for other positions, and I was offered the ability to start essentially the entire benign hematology, but specifically the Hemophilia Treatment Center at Phoenix Children's Hospital. Now, Phoenix Children's Hospital is a massive children's hospital, but at the time I started there in the late 90s, really had no history of research at all. They were a COG, Children's Oncology Group member, but really were doing no research in any field other than that clinical research in oncology. And what they allowed me to do is come in and start that clinical program and use that as a basis to start a clinical research program. Now, coming out of the lab, I thought, you know, I'm a lab researcher, I can do clinical research, this is no problem at all. And actually what I found was the vagaries of clinical research were much harder than designing, you know, a well-designed knockout mouse study or cell culture study where you pretty much have control of everything that you're doing. Sometimes your patients don't show up for their research visits, and you got to figure out how to deal with that. So when I started in Phoenix, I was able to hook my wagon onto another mentor that is hopefully going to be here later, Marilyn Manco-Johnson. So Marilyn is one of the most remarkable people that you'll ever meet in terms of her energy, in terms of her inclusiveness, in terms of her willingness to bring people into her sphere, even if they're not right at her institution. And my 10 years at Phoenix really gave me that opportunity to work closely with Marilyn and use her expertise in clinical trial design and figuring out how you make the system work for your patients when you want to have clinical research. So after about 10 years in Phoenix, I got recruited to Dornbecker Children's Hospital at Oregon Health and Science University, or also known as Ohio Health and Science University, where I was... An O is an O, whatever. And they asked me to grow the hemophilia program there also. And that was also the time where I was invited and participate in the founding of the American Thrombosis and Hemostasis Network as a board member, and that's where I met Dr. Kulkarni, another one of my mentors. So the idea that Andy was talking about and, you know, grabbing that opportunity with the people that you're around, what you're going to find out is in this field of non-malignant hematology, there are really incredibly wonderful people who are interested in your career, who are going to want to help you advance your career. And for me personally, we have three of the most important people in my professional career sitting in the room today. And if Marilyn were here, we would have that fourth person. So as we developed the hemophilia program at Dornbecker Children's, it became very clear that we had a significantly underserved population. That was our girls with bleeding and clotting disorders. And not only were they underserved, because, you know, I could just do more clinics and see more people, but as I aged and got more crabby, when I walk into a 13-year-old young woman's room and say, okay, tell me about your period, not quite as receptive as it was. So luckily, right about the time I started to go bald, one of our fellows was starting to look for a job. She had done her research in benign hematology with our biomedical engineering. That's Christina Haley, who is part of the Learning Action Network here. We recruited Christina to OHSU and Dornbecker, and she started up our girls bleeding and clotting disorders clinic, which is, we call spots, dots, and clots. What's most powerful about Christina's clinic is not only is she serving this underserved population, but it is essentially her laboratory. So all these questions that we ask about our patients, Christina is designing systems to answer those questions, and she's working with our biomedical engineers to design assays that have never been done before. She's working with Dr. DiPaolo, who was with Dr. Nugent before, to look at the omics, proteomics, genomics, transcriptomics, all having to do around with young women in bleeding and clotting disorders. One of the most important things that Christina did when we hired her, and we were trying to think, well, how do you start a clinic for girls with bleeding and clotting disorders? We had this discussion and we came up with the idea of, let's call the FWGBD. I'm sure there's other people who have started clinics like this would be willing to share their experience. And just like often happens when you reach out for help, you become the helper. Christina and Carrie started out the FWGBD Learning Action Network with the support of the board of FWGBD. So if this is something that you guys are interested in, I would very much recommend that you get involved with the FWGBD Learning Action Network for bleeding and clotting disorders. As an organization, we are going to be starting a parallel organization for people with sickle cell also. So Tricia Wong, another one of our more junior people at OHSU, is going to be involved in the sickle cell portion of the FWGBD Learning Action Network. So based on that work, when there was a position open on the FWGBD board, I got a call on my cell phone from Roshni, and whenever I see that name Roshni show up, I'm very excited because I get to talk to Roshni, but I know something important is going to happen too. So she called me and asked me to join the board, and it took me 1/2 of a second to say yes because of the important work that this organization is doing. So that's really how I got here. My career has morphed from a bench researcher into a clinician, clinical researcher, now almost into a clinician administrator. I run they run our hematology program. I run our hemophilia program, which is a lifespan program, so kids through adults. I work with our state to ensure access to for kids with bleeding and clotting disorders, kids and adults. And when Carrie asked me to talk about my powerful career, what I would say is I would change that word a little bit and say, instead of talking about powerful career, I'd like, hopefully I communicated how meaningful my career has been. That to me has been the most important part. There's never been a day I have woke up and said, oh boy, I wish I was doing something else. Working in pediatric hematology, working with our adult colleagues, working with our national and international colleagues has been an incredibly enjoyable and meaningful part of my career. And I welcome you all into this career because you're going to absolutely love it. So thanks very much for talking today, allowing me to talk today.